Coronavirus is a disease caused by a new coronavirus discovered after an outbreak in Wuhan, China, in December 2019. From the initial outbreak, this coronavirus has spread to more than 100 countries globally and has affected thousands and maybe more of people. As of yet, there is no vaccine against the coronavirus. Researchers and scientists are currently working on creating a vaccine for this virus, as well as potential treatments for COVID-19. The disease is more likely to be seen and cause symptoms in older adults about 60+ years and those with underlying health conditions. Most people who develop symptoms of coronavirus experience fever, cough, shortness of breath, fatigue. What types of treatments are being explored, and what to do if you develop symptoms of coronavirus? There currently isn't any vaccine against developing coronavirus. Antibiotics are also ineffective because coronavirus is a viral infection and not bacterial. If your symptoms are severe, supportive treatments may be given by doctor or at a hospital. The type of treatment may involve fluids to reduce the risk of dehydration, medication to reduce a fever, supplemental oxygen in more severe cases. People who have a hard time breathing on their own due to coronavirus may need a respirator. What should you do if you think you have symptoms of COVID-19? If you think you have symptoms of coronavirus, follow this protocol. 1. Gauge how sick you are. Ask yourself how likely it is that you came into contact with the coronavirus. If you live in a region that has had an outbreak, or if you have recently traveled abroad, you may be at an increased risk of exposure. 2. If you have mild symptoms, call your doctor. To reduce transmission of the virus, many clinics are encouraging people to call or use live chat instead of coming into a clinic. Your doctor will check your symptoms and work with local health authorities and the Centers for Disease Control and Prevention (CDC) to determine if you need to be tested. 3. Stay home. If you have symptoms of coronavirus or another type of viral infection, stay home and get plenty of rest. Be sure to stay away from other people and avoid sharing items like drinking glasses, utensils, keyboards, and phones. How to avoid infection from the coronavirus? The novel coronavirus is primarily transmitted from person to person. At this point, the best way to prevent getting infected is to avoid being around people who have been exposed to the virus. According to the CDC trusted source, you can take the following precautions to lower your risk of infection. Wash your hands thoroughly with soap and water for at least 20 seconds. Use hand sanitizer with at least 60% alcohol if soap is not available. Avoid touching your face unless you have recently washed your hands. Stay clear of people who are coughing and sneezing. The CDC recommends standing at least 6 feet away from anyone who appears to be sick. Avoid crowded areas as much as possible. Older adults are at the highest risk of infection and may want to take extra precautions to avoid coming into contact with the virus. The bottom line. At this point, there is no vaccine to protect you from the coronavirus. There also are no special medications approved to treat the symptoms. Researchers around the world are working hard to develop potential vaccines and treatments. There is emerging evidence that some medications may have the potential to treat the symptoms of coronavirus. More large-scale testing is needed to determine if these treatments are safe. clinical trials for these drugs could take several months. Stay safe and take precautions.